So now in my patient's room, I would wash my hands, I would do an environmental check, and at this point I'm going to explain the procedure to the client and gain consent. Hi there, my name is Kate. I'm a nursing student from Durham College, and I'm here to give you your IV antibiotic cefazolin. Is that okay? Yes? Okay. Can you tell me your name, please? Sid Garland. Sid Garland. And the date of birth? 11/08/1965. 11/08/1965. And could you tell me, do you have any allergies? Penicillin and codeine? Penicillin and codeine. And what type of reaction do you have? A rash? A rash? Okay, thank you. So at this point, I've taken out my medication IV bag here, and come over here, and I'd make sure my main line is stopped, and I would hang up the hanger behind here, and then I would take an alcohol swab, and I would swab the upper port. Wait about 10 to 15 seconds for that to dry. In the meantime, I'd take off the cap here, and in a hand-to-hand motion, I would connect the two together here. Okay. Okay, so I am now going to keep my mini bag a bit lower, open up here till the chamber fills about halfway. There we go. So pour it up again. Hang my mini bag. I'm now going to drop this bag here. And at this point, I would regulate my drops. So I have 11 drops per minute. So, 11 drops per minute. So that's approximately about 3 drops every 15 seconds. So, at this point, I'm going to open up the clamp on my mini bag. And I'm going to start to regulate with my main clamp here. I'm looking for about 3 drops every 15 seconds. And I'm going to start that 15 seconds now. I'm going to try again. Starting now. I'm gonna try again. Starting now. Okay, I'm pretty happy with that. So now I'm gonna start my full minute count. And I'm gonna start that starting now. Okay, I'm pretty happy with that. So at this point, I'm going to show you the drip chamber. So at this point, my health teachings for Mr. Garland would be to advise him that it is an antibiotic for the surgical site on his left leg. And because he hasn't taken the medication before, we ask that if he notices any type of rash or if he's not feeling well, that he report it to us immediately. The post-assessment would be I would come back within 10 to 15 minutes to observe him because the onset is a rapid one at 10 minutes, and we check for any signs of reaction and most likely do a set of vitals as well. And then at this point, I would come back to my med cart and I would document on my MAR. So I'm going to put the date at the top. And then I gave it at 0600. So I'd put my initials and then I would put a line for my cosigner. And then the site was the left, the left hand. So at this point, I would call over my preceptor for them to come in, cosign, and that would be it.